Carol Einhorn was 68 years old and had been battling rheumatoid arthritis for 16 years. It wasn't a dramatic battle. It was the sordid, continuous battle of someone who wakes up every day with itching hands before getting out of bed, who mentally calculates whether they can open the coffee package before trying, who has built 16 years of routine around a body that resists. Carol had learned to live within those limits with the practical elegance of someone who has no choice. In October 2021, her rheumatologist in Cincinnati, Ohio, decided it was time to try methotrexate. The drug had transformed the lives of millions of rheumatoid arthritis patients. It reduced systemic inflammation in a way that conventional anti-inflammatories could no longer achieve in Carol's case. It was the next logical step in the protocol. Methotrexate for rheumatoid arthritis is prescribed in a weekly dose, once a week. This detail, once a week, is the most critical distinction in the pharmacology of methotrexate and the source of the most documented and most lethal error associated with this drug in American medicine. The prescription that arrived at the pharmacy read, Methotrexate 15 milligrams, take daily. Carol took methotrexate every day for 22 days. On the 23rd day, her daughter took her to the emergency room at UC Medical Center in Cincinnati with mouth ulcers so severe that she couldn't swallow, hair falling out in clumps, a white blood cell count of 800 per cubic millimeter, less than 1/10 of the normal minimum value, and an appearance that the attending physician described in the chart with a phrase the daughter never forgot. Patient appearing to have undergone an intensive chemotherapy cycle without adequate support. And that was exactly what had happened. But before revealing the mechanism by which daily methotrexate did to Carol's body what should have taken months of chemotherapy to do, and what the data reveals about how often this specific error occurs in the United States, you need to understand why this drug exists in two completely different doses for two completely different uses, and why the difference between them is the difference between treatment and dissolution. Methotrexate is not one medication, it's two. At a weekly dose of 7.5 to 25 milligrams, once a week, with supporting folic acid, it's an immunomodulator that inhibits the production of inflammatory cells gradually, in a controlled, tolerable way. It's used for rheumatoid arthritis, psoriasis, and Crohn's disease. 17 million Americans have already used it for this indication. With proper monitoring, it's safe. At a daily dose, accumulated over weeks, which is what Carol received its chemotherapy. The same methotrexate, the same molecule, but in a systemic concentration that doesn't give the body time to eliminate what the previous dose left before the next dose arrives. Methotrexate inhibits dehydrofolate reductase, the enzyme that cells need to synthesize DNA. At a weekly dose, cells have 6 days to recover. At a daily dose, the inhibition is continuous. And the cells that suffer the most are those that divide most rapidly, the cells of the gastrointestinal mucosa, the cells of the bone marrow, the cells of the oral epithelium. The intestinal mucosa renews itself every 2 to 4 days. Without DNA synthesis, it cannot renew itself. It falls apart. The bone marrow, which produces white blood cells, red blood cells, and platelets, needs continuous cell division to maintain hematopoiesis. Without DNA synthesis, it stops producing. White blood cell counts drop. Platelet counts drop. The blood loses its ability to defend itself and clot simultaneously. And here's the micro hook that will make you understand why this error is different from any other medical error you've ever heard of. Methotrexate doesn't taste different at the wrong dose. Carol didn't feel anything different in the first few days. She took the pill in the morning as instructed, with water after breakfast. No pain. No signs. Nothing to alert her that each pill was blocking DNA synthesis in the cells that kept the lining of her intestine intact. For 7 days, then for 14, until the 23rd day arrived with ulcers she could no longer ignore. And before I tell you what happened at the hospital, what the doctors found, and what they had to do to try to reverse 22 days of silent destruction, there's a number you need to hear. 25%. That's the proportion of methotrexate dosage errors that result in hospitalization or death, according to a 2020 analysis published in the British Journal of Clinical Pharmacology by Boos and colleagues, reviewing pharmacovigilance data from 6 countries over 10 years. Not methotrexate errors in general. Errors specifically related to confusion between daily and weekly doses. A quarter of dosage errors of this specific type result in death or serious hospitalization. In the United States, the Institute for Safe Medication Practices, ISMP, has classified weekly methotrexate as one of the high-risk medications most frequently involved in fatal errors due to confusion in administration frequency. The error is not rare. The error is not improbable. The error has such a consistent pattern that the ISMP has recommended since 2012 that methotrexate prescriptions for non-oncological indications explicitly contain the word W in bold, that pharmacies have a double-check protocol for this drug specifically, and that patients receive written guidance on the frequency of administration. In 2021, none of these recommendations were mandatory protocol in Ohio. Carol's prescription did not contain the word W. The pharmacy did not perform double-checking, and Carol, who had spent 16 years managing her own condition carefully and attentively, had taken the pill every day because the prescription said daily. She had followed the instructions perfectly. And now you will understand what 22 days of daily methotrexate did to her body, not in general terms. In sequence, structure by structure, function by function. In the first 7 days, daily methotrexate began to inhibit the turnover of the gastrointestinal mucosa. The cells of the oral epithelium, which normally renew themselves every 4 to 5 days, stopped renewing. Small erosions appeared on the lining of her mouth. Carol attributed them to the dry weather in Cincinnati in October. She continued taking the pill. From days 8 to 14, the bone marrow began to suffer. The production of neutrophils, the first line of defense for the immune system, fell below the functional threshold. Without an adequate number of neutrophils, any opportunistic bacteria found an immune system that could not respond. Carol began to feel fatigued, which she attributed to arthritis. The ulcers in her mouth worsened. She took topical pain relievers and carried on. From days 15 to 22, the destruction became systemic. The intestinal mucosa had lost its structural integrity in multiple places. The layer that separates the inside of the intestine from the bloodstream was compromised, allowing bacterial translocation, the passage of intestinal bacteria into the blood, the process that precedes sepsis. Platelets had fallen to 42,000 per cubic millimeter, below 50,000, the threshold below which the risk of spontaneous bleeding becomes clinically significant. Carol's hair had begun to fall out because the hair follicles, which also depend on rapid cell division, could no longer sustain themselves. On the 23rd day, when her daughter took Carol to UC Medical Center, her body was technically undergoing managed disintegration, each rapid cell renewal system failing in sequence, beginning with the most exposed surfaces and progressing to the hematopoietic system. The doctor who received Carol in the emergency room was Dr. Sarah Okafor, the on-call hematologist, 41 years old. She looked at Carol's test to white blood cells 800, platelets 42,000, hemoglobin 7.4, creatinine 2.1 indicating incipient renal impairment, and asked the question that changed the diagnosis. What exactly are you taking and how often? Carol showed the bottle, methotrexate, once a day, 22 days. There were 2 options in that emergency room. The first option, the path the severity of the condition was already forcing was hospitalization in neutropenia isolation, platelet transfusion, leucovorin to compete with methotrexate in the folate pathway and try to reverse some of the enzyme inhibition, and broad-spectrum prophylactic antibiotics to protect an immune system that had ceased to function. The second option was the one that should have existed 22 days earlier, a double check at the pharmacy, a confirmation call to the rheumatologist, a word on the label. Dr. Okafor went with the first option because it was the only one left. Carol would be hospitalized for 18 days. She would need 3 transfusions. She would develop grade 4 mucositis ulcers in her mouth and esophagus reaching a depth that made oral feeding impossible for 11 days, requiring total parenteral nutrition. And she would need a 6-week interval after discharge before her bone marrow recovered sufficient hematopoietic function to dispense with the isolation protocol. But before revealing what the American healthcare system did and failed to do after Carol's case, there is one piece of data that defines the real scope of this problem. The methotrexate error that nearly killed Carol Einhorn is not an isolated case. It is a pattern so well documented and consistent that it has its own name in the drug safety literature: methotrexate weekly dosing error. In 2019, the ISMP published an analysis of 460 serious adverse events related to methotrexate recorded in the American National Medication Error Reporting Program over 15 years. Of the 460 events, 226-49% involved confusion between daily and weekly dosing. Of those 226, 25 resulted in patient death. 25 documented deaths from the same error, in the same country, over 15 years. With the same ISMP recommendation from 2012, weekly highlighted, double-checking in pharmacies, not implemented as a mandatory protocol in any American state. In 2020, the ISMP updated its analysis and found that the error had increased in relative frequency over the previous decade, not decreased. The growing use of methotrexate for rheumatological indications had increased the number of prescriptions, and the number of errors had grown proportionally because the protection protocol had remained voluntary. The mechanism by which daily methotrexate destroys the body is so well understood, so documented, so predictable in its destructive sequence that the question Dr. Okafor carried home after her shift wasn't clinical. It was moral. Why was a mistake with this consequence profile predictable, documented, fatal in a quarter of cases, associated with a specific prevention protocol that has existed since 2012 still happening in 2021? The answer is the most disturbing part of this story, and it's not in the hospital. It's in how the American healthcare system treats safety recommendations that don't become mandates. Carol's rheumatologist's instinct hadn't been wrong. Methotrexate was the right next step for her condition. The dose was within the therapeutic parameters for rheumatoid arthritis. The clinical decision was defensible. What wasn't defensible was what happened between the clinical decision and the pharmacy. The prescription had been transmitted electronically. The electronic prescribing system had not triggered an alert, because the system was not configured to differentiate methotrexate for rheumatological indication from methotrexate for oncological indication, and the daily frequency, although clinically incorrect for the first indication, did not activate any safety alert. The pharmacist had dispensed according to the prescription received. The double-checking recommended by the ISMP since 2012 was not a mandatory protocol in the pharmacy. There was no specific alert for methotrexate in the dispensing system. And Carol, who had diligently managed her own health for 16 years, had taken the pill every day because the prescription said daily, and because in 16 years of medication she had learned that the prescription is the contract of trust between the patient and the system that should protect her. The system had failed at every point where a check could have existed. The doctor made a mistake in the prescription. The electronic system did not alert. The pharmacy did not check. The label did not warn. And Carol, who had done absolutely everything right, had been dissolved from the inside by a medication prescribed to cure her. What American medicine learned from Carol Einhorn, from the 25 deaths documented by the ISMP, and from the 226 serious methotrexate frequency confounding events recorded over 15 years, is that the prevention protocol exists, it is specific, it is simple to implement, and it has been voluntary since 2012. In 2023, the Joint Commission, the main American hospital accreditation body, added weekly methotrexate to the list of high-risk medications that require dual pharmacy verification as a condition of accreditation. It's progress. It's real. But it's not retroactive. And it doesn't reach retail pharmacies where most methotrexate prescriptions for rheumatoid arthritis are dispensed, because the Joint Commission accredits hospitals, not retail pharmacies. Carol survived, with bone marrow that regained function in 6 weeks. With gastrointestinal mucosa that regenerated in 3 months, with kidney function that returned to baseline in 18 weeks, with permanent damage measurable only in tests, a slight reduction in bone marrow reserve that hematologists monitor every 6 months as a documented sequela of severe myelosuppression. She still takes methotrexate, once a week, with folic acid. With the word weekly handwritten in capital letters on the bottle by her daughter, who never again let her mother take any medication without double-checking the label herself. The rheumatologist had his license suspended for 90 days by the Ohio Medical Board. He resumed practice. Carol received no formal apologies from the hospital, the pharmacy, or the doctor. She received the hospital bill for 18 days of hospitalization that the insurance partially covered. The protocol had existed since 2012. It was voluntary. The difference between methotrexate that safely treats rheumatoid arthritis for years and methotrexate that destroys the hematopoietic system and the gastrointestinal mucosa in 22 days is not the molecule, not the dose per tablet, and not the patient. It's a single word on the prescription. Weekly. If you or someone you know starts methotrexate for rheumatoid arthritis, psoriasis, or any non-oncological indication, do 3 checks before taking the first tablet. First, read the written prescription and confirm that it says once a week, not once a day, not daily. If the prescription does not contain the word weekly highlighted, call your doctor before picking up the medication at the pharmacy. Second, when picking up the medication at the pharmacy, explicitly ask the pharmacist, "This methotrexate is to be taken once a week, correct?" If there is any hesitation or if the pharmacist confirms daily frequency, do not take it and contact your doctor immediately. Third, Mark the day of the week you should take it on the bottle with a permanent marker in large letters. Not because you'll forget, but because anyone who picks up the bottle and reads the label will need to understand it before handing it to you. Carol had spent 16 years managing her health with precision and care. The mistake wasn't hers, but the 3 checks that could have prevented 22 days of silent destruction cost 30 seconds each. 30 seconds, 3 times, before the first pill. But methotrexate isn't the only high-risk medication where confusion over administration frequency produces organ destruction in a silent time window. In the next video, warfarin, the anticoagulant that 58 million Americans have used, and the dosage errors that produce brain hemorrhage in patients who were within the therapeutic range at their last exam, and who, due to an interaction with a common food or over-the-counter medication, crossed the threshold for spontaneous bleeding without any alarm sounding. The INR that was correct on Tuesday may not be the INR on Saturday, and nobody will bother to call and let us know.